Good morning, guys. Well, it's afternoon actually. What have I done today? Sunday morning, a lazy Sunday morning. No, as usual, we go sea dipping. It was windy, it was raining, it was cold when I woke up. I had every excuse under the sun to not go. However, accountability. Other people were relying on me, so I had to go. But I could have really made my excuses. I was a little hungover. Apologies. Practice what you preach. And my negative shadow said, just stay here. There's no need. Every week you do it. You can miss 1 week. We don't feel very well. But I sucked it up and I got out there. And it was amazing. It was windy. It was cold. The sea was rough. We were battling the waves. It was utterly epic. And I felt absolutely amazing afterwards. So what did I do? Went to the gym, run the dogs. What next? Time will tell. So we said in the last video, be productive. Movement is life. And boredom is the devil's playground. Get on with it. But your shadow will always be there. Your shadow will always be behind you if you keep moving. So, movement is life. Go away from the negative. Go to positive. And again, we need to appreciate that testosterone won't do the work for you. Testosterone will give you the foundation to put the work in to earn your reward. That was 2 minutes too. And then the rest is up to you. Because it's very easy to take the path of least resistance. It actually confers a survival benefit. Not in our world, but if we were in the jungle, hunting and being gatherers and living according to physiology, which is the reason why we're so ill, because we don't live according to physiology. We wake up, walk to the fridge, have food. We haven't earned that food. We start our metabolism. We're supposed to be predominantly sympathetic, not parasympathetic. We don't comfort eat. We don't need to fuel the body. Get on with it. Be physically active. Go, you know what. So it's all about perspective. Because we have an understanding of physiology. We need to adapt what we're doing in our modern life to live more according to physiology. You've got to live according to principles, not rules, because we all have to go to work. We can't all go hunt, gather. Not but yeah, taking the path of least resistance, maximum reward, ultimately in our world will cause a deleterious outcome. So, a few drinks last night. I'm not proud, but it is what it is. Doggies. Love them. Absolute LA Dex. So, yeah, we do sometimes make mistakes. But with testosterone, hopefully, it's a calculated mistake. And if you do decide to do something stupid, you're going to pay the consequences. So I thought today, yeah, no, don't need to do it. Do need to do it. So I'm not listening to my shadow. I'm getting out there, getting on it. And I might not be 100%, but I'm 90%. And next time, I'm going to decide, should I? Shouldn't I? And hopefully the answer will be, no, you shouldn't. But as I said before, we're idiots. And we do sometimes take the path of least resistance, maximum reward. But testosterone allows you to be more considered in your approach to life. And we should be aspiring to make better choices. Because ultimately, all of those hedonistic things that we've engaged in the past, they're meaningless. They have absolutely no meaning. You've been drunk 1,000 times. Has that enriched your life? You've probably got a few good stories, but not really wholesome stories, are they? You've done something stupid. You're laughing at yourself, laughing at other people. That's actually not very good, is it? That's not a good character trait. So again, We don't listen to people who are going to cause us harm. We're going to listen to our internal voice that is going to be considered. And low testosterone messes with that voice. We don't understand what we need to do, because when we try to do it, it doesn't work because of low testosterone. So we decide to take the path of least resistance, maximum reward. So when these guys get absolutely morbidly obese, I can kind of see why. I couldn't before, but with my improved understanding of physiology, I get it. What's the point? What is the point? You put the effort and you don't see the reward because you don't have the foundation. You've got to get the foundation. So again, you're going to go to the GP. He's going to give you antidepressants for your low mood. He's going to give you Viagra. He's going to refer you for talking therapies. But without a steady foundation, you've got no chance. But you must have a holistic approach. So it isn't a one-size-fits-all methodology. Because when guys go on testosterone replacement therapy, they realize, if they're under my care and supervision, that they're going to be given truths. You need to know what you need to know, not what you want to know. Because ultimately, if I tell you what you think you need to know, and it's not good for you, I might have satisfied your desire at that particular time, but long term, it causes harm. So microdosing TRT is the future of testosterone replacement therapy, mimicking physiology. Testosterone cypionate and HCG will always be the gold standard here at the Men's Health Clinic. We're not going to try anything else like the new nasal spray or creams, because if you understand physiology, if you understand pharmacokinetics, it doesn't make sense. And if something doesn't make sense, what's the point in doing it? Because I want to feel good. You go onto the internet and all of these people are talking about trying this, trying that, raising the dose. Get the foundation, get your levels optimized, and work on everything else. You shouldn't be aspiring to have a drug effect from a medication that is simply there to normalize your male androgen levels for optimal health and well-being. You don't really want to feel the change. Now, the daily microdosing allows you to mimic physiology. So you are sort of feeling a change because, again, the laws of pharmacokinetics, by the very nature of injecting a testosterone and HCG in the morning, you are going to get a subtle peak. So if the premise is stability, it is, from a pharmacokinetic perspective, it is also mimicking physiology by daily administration. So some clinics will tell you, Monday, Wednesday, Friday, have the weekend off. The physiology doesn't have the weekend off. How bizarre. I feel okay. Okay, feel okay. I don't think I need to do daily injections. Okay, you don't need to do daily injections. I'm not here to really convince you of anything. I'm here to just tell you what we believe and what through clinical practice we have seen, and that is microdosing TRT is the closest way of optimizing your long-term physical and psychological well-being. Because it's not just testosterone, it's not just how you feel, it's the effect of testosterone replacement therapy on all of your other parameters. Your blood pressure, your hematocrit, your visceral fat, your lean muscle mass, the list goes on. So as much as it is about feels, it's about normal. There's nothing wrong with normal. Normal is normal. Average is bad because we live in a sick society, but we should be aspiring to be normal. We should be aspiring to be the best version of ourselves and keep making positive steps towards that. Go earn your reward.